Well, hello everybody, welcome back to my channel. This is Glitzzy Gem. How's everybody doing today? I'm glad I'm able to do this video. I've been wanting to do this video for a while. Just haven't had a chance to do it sooner. Personal issues, what I've been going through. So hopefully once all these personal issues, health issues subside, which I know it's just ongoing and going. But this is the reason why I do my awareness videos as well, because it kind of helps me read up on illnesses and treatments, and it just kind of gives me that broad knowledge of illnesses. So considering that I do have illnesses, and considering that I do have all these stresses going on in my life, at least I'm able to be educated on awareness months, and awareness on other illnesses that I may not have, but I do want to share with you guys about these illnesses. So July is Sarcoma Awareness Month. If y'all did not know that, their lapel is yellow. It's a yellow lapel. And sarcoma is a bone cancer. So I was reading up on the Sarcoma Foundation of America. It says here that sarcoma is considered to be the forgotten cancer. This is why we have July as Sarcoma Awareness Month. So efforts to encourage research and drug development are much more challenging due to a lack of awareness and understanding. So most people don't know that this cancer even exists. The Sarcoma Foundation of America are tirelessly working every day to raise awareness. They aim to further highlight the extraordinary challenges that sarcoma patients face, and the need for more sarcoma research and better sarcoma therapies. So this is it just kind of, I don't want to say it makes me mad, but I just don't understand why, there's some cancers that are being forgotten about, and not a lot of people are aware of these type of illnesses. And I'm thinking, I'm not sure what the percentage of rate is of people that have sarcoma, but we're probably going to get into it and we're going to find out. So, but it just kind of really, it affects me, because I would really like for awareness to be brought up with any type of illness, and not be forgotten. That's where my battle is right there. It's just I just cannot understand why some of these illnesses get forgotten, and then they don't have the research or the money to even develop a drug to cure this illness, but yet they're able to raise money for other cancer awarenesses, which is a good thing. I'm saying that's a bad thing, it's a good thing, but also include all these other cancers. Don't just single them out. And I guess this is why we're doing this awareness video today, to kind of raise awareness for everybody, to pay more attention and to be more observant about these issues. So we're gonna go ahead and go, and I bookmarked my notes here, so bear with me. Okay, on WebMD, we're asking the question, what is sarcoma? A sarcoma is a rare kind of cancer. Sarcomas are different from the much more common carcinomas because they happen in a different kind of tissue. Sarcomas grow in connective tissue cells that connect or support other kinds of tissue in your body. These tumors are most common in the bones, muscles, tendons, cartilage, nerves, fat, and blood vessels of your arms and legs. But they can also happen in other areas of your body. You know, just imagine, you know, it's more underlying. You know, it's not like it's inside the body. You know, this cancer is inside the body, in the blood vessels, the fats, the nerves, the cartilage. You know, places where you can't even see with the eye unless, you know, you're doing surgery and or doing x-rays. That's the only way you're able to see this cancer. It's not like, sometimes you're able to see it once they bulge out from these areas. Like if you have some in your knee or your leg, you know, you're probably able to see it more. But in your nerves and in your fat and blood vessels, you cannot see that, you know, without any kind of blood tests. You know, and I'm going to go through some of the symptoms, but before I do want to finish reading off this paragraph here on sarcoma, because it does tell you what the symptoms are, you know, of sarcoma. So I want to see how that falls in place, you know, why, how you're not able to detect it right away, and it's only treatable or detectable or diagnosed by a medical practitioner. So let me read on. It says here, although there are more than 50 types of sarcoma, 50 types of sarcoma. I thought there was just only one, but there's 50 types of sarcoma. They can be grouped into two main kinds, which is good. Two main kinds, which is soft tissue sarcoma and bone sarcoma, or osteosarcoma. About 12,000 cases of soft tissue sarcoma and 1,000 new cases of bone sarcomas will be diagnosed in the U.S. in 2017. So we're in 2019. I don't have the stats on that. Sarcoma can be treated often by having surgery to remove the tumor, which is a good thing. So we're going to go ahead and go into the symptoms of sarcoma. And then we're going to go into the risk factors. So the symptoms of sarcoma are, let's read a little paragraph about the symptoms of sarcoma. It says here, soft tissue sarcomas are hard to spot because they can grow anywhere in your body. Like I was just saying, I kind of had an idea, like, yeah, how are you supposed to know if it's inside your body? So most often the first sign is painless lump. As the lump gets bigger, it might press against nerves or muscles and make you uncomfortable or give you trouble breathing. Wow. Or both. So there are no tests that can find these tumors before they cause symptoms that you notice. So you can be having this cancer in you without even realizing it, you know, until you start having these symptoms that you notice. And then when you go to the doctor and say, I'm having these symptoms, and they tell you, oh, you have sarcoma. And so that's hard, because when you could try to prevent it before it happens, and it's like they say, they don't know when it's going to happen, how it's going to happen. They just know where it happens and how people find out. So let's read on. Osteosarcoma can show obvious early symptoms, including pain off and on in the affected bone, which may be worse at night. Swelling, which often starts weeks after the pain. Okay. A limp if the sarcoma is in your leg. Okay. Children and young adults get osteosarcoma more often than adults. And because healthy, active children and teens often have pain and swelling in their arms and legs, osteosarcoma might be mistaken for growing pains or a sports injury. If a child's pain doesn't get better, gets worse at night, and is in one arm or leg rather than both, talk to a doctor. I remember when I was little, And I remember always having these pains in my knees all the time, both knees. And it always happened at night. And I didn't know what was going on with me. I didn't know why I kept having these pains. I even felt like I would get a fever. And it always happened. And, you know, I mean, kids don't think about any of these things. Kids don't think about these, you know, these cancers that could, you know, that you can have. Luckily, it wasn't cancer because, you know, how long I had to endure this pain. I think it took me, I think, maybe a year or 2 years before my pain stopped, you know, before the pain stopped in my knees. And I think, you know, there were growing pains because I was little and I was still growing. So, and the only way that I was able to soothe that was I had to keep rubbing I would lay in the bed and I would always have to kind of like rub my leg up against the mattress, rub my leg, you know, the back of my leg, or just moving my leg around just in circles or just around, you know, just to kind of like, you know, just help me fall asleep because I couldn't, it was so painful that it wouldn't go away, and I don't know how else to soothe the pain than just to kind of, you know, and I would get like burning, like you know how you get rug burn, but I was getting like sheet burn because I kept, you know, rubbing, you know, my legs up and down the sheets, you know, because they were in side to side motions, up and down, and then even on the sides, you know, it's going like this, and just, you know, just kind of like, you know, just rubbing up against my sheets because it was just burning. I mean, it was hurting. And so after a year or two, like I said, you know, the pain stopped. So, which is good because I don't think I would have told my parents, you know, hey, I've been having this pain for so long and I don't know what's going on. I just know that I have this pain. I didn't even tell my parents about the pain, but I know that I was having it. Okay, so let's go over, before we go into diagnosing sarcoma, I want to go ahead and read up on the risks of sarcoma, the risk factors. It says here on WebMD, it says, we don't yet know what causes sarcoma, but we do know some things that raise the risk of developing one. Other people in your family have had sarcoma. You have a bone disorder called Paget's disease. You have a genetic disorder such as neurofibromatosis, Gardner syndrome, retinoblastoma, or Lee-Fraumeni syndrome. You've been exposed to radiation, perhaps during treatment for an earlier cancer. So that's how. So those are the risk factors on sarcoma when you're developing one. Okay, so let's go into diagnosing sarcoma. If your doctor thinks you may have a sarcoma, you'll probably need a full exam and tests, including a sample of cells from the tumor called a biopsy, imaging tests such as CT scan, an ultrasound, or MRI to help see inside your body. A bone scan if you might have osteosarcoma. So a bone scan, what does that entail? Let me read that up. It says file not found in the directory. What the test is on a bone scan. So that's something the first time I ever heard of a bone scan. Now, I do want to go into the levels of sarcoma because I know they have like stages 1, 2, 3, and 4. So let me see if I can find stages of sarcoma here. I think I might have bookmarked the stages. Well, it's telling me a treatment of sort of soft tissue sarcomas by stage. Soft tissues. This is soft tissues. Now we're looking for the actual, the other one, the one with the bone, which is called, because it's in two categories, the tissue sarcoma and the bone sarcoma. The bone sarcoma is the one that we're talking about, the osteosarcoma. So, and the one that I bookmarked in my phone here was really for the tissue one, tissue sarcoma. You know, it gives you stages 1, 2, and 3 stages up to stage 4 of tissue sarcoma. So let me see if there's anything that I can find online on osteosarcoma. Here we go. Under the American Cancer Society, it tells me here osteosarcoma stages. After someone is diagnosed with osteosarcoma, doctors will try to figure out if it has spread, and if so, how far. This process is called staging. The stage of a cancer describes how much cancer is in the body. It helps determine how serious the cancer is and how best to treat it. Doctors also use a cancer stage when talking about survival statistics. The stage of an osteosarcoma is based on the results of physical exams, imaging tests, and any biopsies that have been done, which are described in tests for osteosarcoma. A staging system is a standard way for the cancer care team to sum up the extent of the cancer when trying to figure out the best course of treatment. Doctors often use a simple system that divides osteosarcomas into 2 groups, localized and metastatic. Doctors can also use more formal staging symptoms to describe the extent of an osteosarcoma in more detail. The osteosarcoma staging can be confusing. If you have any questions about the stage of the cancer, ask someone on your cancer care team to explain it to you in a way you understand. So this is talking really to the people who have the sarcoma cancer. So localized osteosarcoma, that's the first staging method that they use. And the other second staging is metastatic. But the first staging is called localized osteosarcoma. A localized osteosarcoma is seen only in the bone it started in, and possibly the tissues next to the bone, such as muscle, tendon, or fat. About 4 out of 5 osteosarcomas appear to be localized when they are first found, but even when imaging tests don't show that the cancer has spread to distant areas, most patients are likely to have very small areas of cancer spread that can't be detected with tests. This is why chemotherapy is an important part of treatment for most osteosarcomas. If it isn't given, the cancer is more likely to come back after surgery. Doctors further divide localized osteosarcomas into 2 groups, resectable and unresectable. So resectable cancers are those in which all of the visible tumors can be removed by surgery. Non-resectable or unresectable are osteosarcomas that can't be removed completely by surgery. Now we're going to go into metastatic osteosarcoma. A metastatic osteosarcoma has clearly spread to other parts of the body. Most often it spreads to the lungs, but it can also spread to other bones, the brain, and other organs. About 1 out of 5 osteosarcomas has spread at the time of diagnosis. These cancers are harder to treat, but some can be cured if the metastasis can be removed by surgery. The cure rate for these cancers improves markedly if chemotherapy is also given. Okay, so now MSTS. This is short for Musculoskeletal Tumor Society Staging System. A system commonly used to stage osteosarcoma is the MSTS system, also known as the Eniking system. It is based on three key pieces of information: the grade G of the tumor, which is a measure of how likely it is to grow under the microscope. Tumors are either low grade or high grade, low grade being G1 or high grade being G2. So low grade tumor cells look more like normal cells and are less likely to grow and spread quickly. Okay, so the G1 cell is the one that is less likely to grow and spread quickly, while high grade tumor cells like the G2 look more abnormal. This is scary. Because, you know, you don't want either or. You don't want G1 or you don't want G2. But, you know, it's worse to have G2. The extent of the primary tumor T, which is classified as either intracompartmental T1, meaning it has basically remained within the bone, or extracompartmental T2, meaning it has extended beyond the bone into other nearby structures. So again, T2 is the worst one because it's spreading already beyond the bone. But T1 is also just as bad because it's in your bone. You know, if the tumor has metastasized M, which means it has spread to nearby lymph nodes, which are bean-sized collections of immune system cells or other organs. Tumors that have not spread to the lymph nodes or other organs are considered MO, while those that have spread are called M1. These factors are combined to give an overall stage used in Roman numerals from 1 to 3. Stages 1 and 2 are further divided into A for intracompartmental tumors or B for extracompartmental tumors. So stage 1A, which is grade G1, tumor T1, metastasis MO, which means G1 is the low grade and the tumor is T1, which is it basically remained within the bone, and MO, which means it has MO, which means there's no spread to nearby lymph nodes. Now, that was stage 1A. Stage 1B, it's the grade G1, which is the one that is the low grade tumor, and T2, which is the one that goes beyond the bone into other nearby structures, and there's no metastasis nearby lymph nodes or bean-sized collections of immune cells, system cells, or other organs. Now, 2A, this is stage 2A, which is grade G2, and G2 is the high grade, and T1, which is the intracompartmental, meaning it has basically remained within the bone, and MO, which it has not spread to any nearby lymph nodes. So by that's 2A. So now 2B, which is G2, which is the high grade tumor, and then T2, which means it's extra compartmental, meaning that it has extended beyond the bone into other nearby structures. And then there's no nothing near the lymph nodes or organs around it. That's 2B. Now stage 3, it could be either G1 or G2. And it could either be T1 or T2. And this is when it goes into M1, which is the metastasized, spread to nearby lymph nodes or other organs. Tumors that have not spread to the lymph nodes or other organs are considered MO, while those that have spread are M1. So that's pretty scary. Yeah. In summary, low-grade localized tumors are stage 1. High-grade localized tumors are stage 2. Metastatic tumors, regardless of grade, are stage 3. Yeah. There's another staging system called T&M. Is used to stage bone cancers, including osteosarcomas. It's the American Joint Commission on Cancer, T&M system. This system is based on 4 key pieces of information. T, which describes the size of the main primary tumor and if it appears in different areas of the bone. N, which describes the extent of spread to nearby regional lymph nodes. Bone tumors rarely spread to the lymph nodes. M indicates if the cancer has metastasized to other organs, which is spread to other organs of the body. Most common sites of spread are to the lungs or other bones. G stands for the grade of the tumor, which describes how the cells look under a microscope. Low-grade tumor cells look more like normal cells and are less likely to grow and spread quickly, while high-grade tumor cells look more abnormal. Numbers after T and M and G provide more details about each of these factors. Once the T, N, and M categories and the grade of the bone cancer have been determined, the information is combined into an overall stage. These stages, which are different from those of the MSDS system, are described by Roman numerals from 1 to 4 and are sometimes divided further. For more detailed information on the AJCC T&M staging system for bone cancer, see bone cancer stages. So this can go up to stage 4 using this T&M staging system. Yeah. So it goes really in depth. It's this procedure is a very in-depth procedure for bone cancer on sarcoma. We can go into the other stages of stage 4, but I think we kind of summed up a little bit. Y'all kind of have an idea of how they stage the cancers. So now we're going to go back into WebMD, and we're going to finish up with what treatments there are. I know that surgery is one of the treatments, and chemotherapy. You have to have chemotherapy, otherwise it can come back if you don't have chemotherapy. And surgery for sure to remove it. Okay, sarcoma treatments. How your sarcoma is treated depends on what type you have, where in your body it is, how developed it is, and whether or not it has spread to other parts of your body or metastasized. And that's whenever it's talking about the lymph nodes and bean-shaped organs in your system. So surgery takes the tumor out of your body. In most cases of osteosarcoma, the doctor can remove just the cancer cells, and you won't need your arm or leg removed too. You won't need that done. Radiation can shrink the tumor before surgery or kill cancer cells that are left after surgery. It could be the main treatment if surgery isn't an option. Wow. Okay, chemotherapy drugs can also be used with or instead of surgery. Chemo is often the first treatment when the cancer has spread. Targeted therapies are newer treatments that use drugs or man-made versions of antibodies from the immune system to block the growth of cancer cells while leaving normal cells undamaged. Surviving sarcoma. Most people diagnosed with a soft tissue sarcoma are cured by surgery alone. If the tumor is low grade, that means it is not likely to spread to other parts of the body. More aggressive sarcomas are harder to treat successfully. The survival rate for osteosarcoma is between 56% and 90% if the cancer has not spread to distant parts of the body. It is more likely to be cured if all of the cancer can be removed by surgery. So that's all the information I have on sarcoma. I do not have slideshows. I do not have a skit today, you know, to show you guys, but just my concern about sarcoma awareness, and the stages you go through, and the state, and how they even separate the staging of the sarcoma cancer. You know, that's just my concern, and that's just you know, the main idea, the main point of this the cancer, of the sarcoma illness. You know, so I just hope that, I'm glad that I was aware of this, because I did not know about sarcoma, and now that I'm aware of it, yeah, I would try to do more in, you know, because really, what can you do? I mean, I know that the Cancer Association, the American Cancer Association, I know that they do need funding. I guess you can go and help them with funding, you know, for this type of cancer, because anybody in your family, anybody, or if you're going through that, really need the help, you know, to get this resolved, because you don't want it to spread. And there's a chance, you know, like through surgery, like I said, anywhere from 65% to 90%, you know, it can be removed by surgery and you no longer will have it, which is a very good blessing, which is a very good, point, a very good bright side to the sarcoma, to the osteosarcoma bone cancer. And do the chemotherapy and all that, just, you know, will help you battle that cancer. So with that note, I'm going to go ahead and end this Geek Day session. I'm glad that you were able to join me on this Geek Day session, and I'm glad that you're interested in finding out more about sarcoma, the bone cancer, and the awareness in July, you know, for it. And I hope that, you know, y'all would look into these awarenesses each month, and, you know, see if there's anything that you can do to, if there's a way that you can contribute by helping them, you know. Like I said in one of my previous videos, I wish I could have gone back into, I could have had some kind of like doctorate's degree, or I should have gone to school for, you know, like a doctorate degree, or just in researching a cure for cancer, because cancer is like, you know, it's still out there. It's still, cancer is still something that has been with us for centuries, and there still hasn't been a cure. You know, people survive, which is, you know, which is good, which is a blessing. But what about those who can't survive? They need the treatment. You know, they need more treatment. They need more research on it. They need help. They need help with this cancer. And it's sad to see families, you know, see their other family members go through the cancer, and, you know, it's just difficult. It's difficult for them to go through that. And you know, I'm happy for those who do survive. I just wish that all of them survived. I wish that all of the cancer patients are able to survive, but realistically, not all of them do. And it's just that just really bothers me a lot, because I'm really the type of person that just wants justice for these people who have cancer. And it's like, why isn't there a cure? Why are people dying of cancer? Why should they even die? You know, I mean, I don't know. I guess I'm just getting too deep into, you know, caring and worrying about, you know, those who do have cancer and those who are not able to survive it because there isn't a cure. And that just really just doesn't sit well with me. It just doesn't. It doesn't sit well with me. But it's just a part of the way the health system is. It's just a part of the way the disease is, you know. I mean, the disease is the way it is because that's just how it's been for centuries. And hopefully one day soon we'll no longer have to worry about cancer. If somebody has cancer, I hope that one day we get to the point where they say, oh, you have cancer? We got the cure. You're not going to die. You're going to survive. You know, and it takes a lot on the family's part, and it takes a lot on the person who's going through it. It takes a lot on their part as well to survive that. So on that note, I'm going to go ahead and end my video on this, and I'm glad you joined me, like I said, and I hope you join me on my next videos when it comes to awareness videos. And yeah, and I just love to do these videos. I'm going to continue to do videos on all my other subjects, on awareness and maybe other illnesses as well. It doesn't necessarily have to be about cancer awareness, but right now that was my main goal this year. I've been, you know, just reading up on a lot of the you know, awarenesses for the month, and usually most of them are cancer awarenesses, and maybe next year you might hear something different. So I hope you stay tuned to watch those videos, as well as the videos that I am uploading this year for cancer awareness videos. So I love you, gems. Thank you for watching. I appreciate you guys, and I'll see you soon in my next video.